Good evening, everyone. Welcome to this Gyan Pravah episode number 193, which is a series of podcast series by Fogsi. And this is a Fogsi presidential initiative. And Dr. Sarita Shamsundar, I'm the Fogsi Gynae Oncology Committee Chairperson, and I'm the host for the 9th of every month. Our president, Dr. Sunita Tandulwadkar, is a visionary leader of Fogsi and started this year's theme with Ek Rashtra, Ek Mission, Swasth Nari Samriddh Vatan, Har Ghar Fogsian. And this resonates deeply with our mission to empower women and enrich lives. So she has started many initiatives like Know Your Numbers, Sampurna Swasth Janma Abhiyan, Aprachita Sampurna, Do Tike Zindagi Ke, the flagship Eagle project, this big project about HPV vaccination, Arogya Yogya Yatra, which goes to different religious places, raising public awareness about health. Gyan Pravah, this is the podcast series, and Fogsi Anubandh, along with 7 publications, and the Arogya Sakhi app, which is for health education of the women. We are weaving a strong and inclusive fabric that connects every Fogsian to the heart of the association. So these efforts ensure that each member feels valued, involved, and an integral part of our shared mission. So some initiatives related to cancer are the Do Tike Zindagi Ke, which is about HPV vaccination, raising awareness amongst the IMA, that is Indian Medical Association members. So the aim is to train 50,000 IMA doctors on HPV vaccination. Nirmal Banaras Abhiyan, this is about the HPV testing for cervical cancer, and then a lot of educational programs for the HPV vaccination. Swasth Nari Abhiyan Yatra, this is about breast and cervical cancer awareness. So, and the many programs and new programs are being launched every day. So thank you, Sunita Madam, for this wonderful initiative where we are connecting to so many people, important people all over India and even across the globe, actually. So today we have Madam Mrs. Sangeeta Jaitley. So this is going to be incredibly powerful. We have Madam Sangeeta Jaitley, who's a cancer survivor whose journey through diagnosis, treatment, and healing is nothing short of inspiring. So whether you or someone you love has been touched with cancer, or just here to listen and learn, this conversation is honest, raw, and filled with a kind of resilience that reminds us what it means actually to truly live. So Madam Sangeeta Jaitley is a respected public figure known for her quiet dignity, social commitment, and dedication to preserving the legacy of 2 prominent Indian statesmen, her father Shri Giridhari Lal Dogra and her husband Shri Arun Jaitley. Her family, she is the daughter of Shri Giridhari Lal Dogra, a legendary political leader who served as the finance minister of Jammu and Kashmir for 26 years and was twice elected as member of parliament. In 1982, she married Shri Arun Jaitley, a senior BJP leader, eminent lawyer, and former Union Minister of Finance and Defense. So they have 2 children, Sonali and Rohan, and both are practicing lawyers. She herself holds a master's degree in English honors from Jammu University. She is a trustee of the Shri Giridhari Lal Memorial Trust, and she has, which was established in the memory of her father. The trust regularly organizes memorial lectures, public dialogues, and community initiatives to highlight his contribution to responsible governance and economic policy in Jammu and Kashmir. She is also the director of Shri Arun Jaitley Foundation, established in December 2019 to uphold and carry forward the ideals of her late husband. The foundation focuses on public welfare, legal education, youth support, and social justice initiatives across the country. She is also a strong advocate of ethical public service, and she made headlines when she voluntarily declined the pension entitled to her as the spouse of a former member of parliament. At her request, the amount was redirected to benefit the Group C employees of the Rajya Sabha Secretariat, leading to the establishment of the Shri Arun Jaitley Financial Assistance for Group C employees. So this is a welfare scheme that provides scholarships for employees' children pursuing professional courses and extends emergency medical and bereavement aid to deserving families. So a very benevolent gesture, madam. advocacy for regional causes. She has remains actively engaged with public causes, especially those related to Jammu and Kashmir. She advocated for the conversion of the Jammu-Mumbai train into a daily service to better serve citizens, patients, and migrant families. And she proposed the introduction of a low-cost express train model after the Garib Rath, and strongly urged the revival of the Dogri language satellite channel to promote the Dogra community's linguistic and cultural heritage. She is widely admired for her grace, principled stance, and ongoing engagement in meaningful causes. Through her roles in the Sri Girdhari Lal Memorial Trust and the Sri Arun Jaitley Foundation, she upholds the family's enduring legacy of public service, national integrity, and social empowerment. Thank you so much, Madam, for joining in and to share your valuable thoughts.
Good evening, everyone. It's my privilege to come and speak to you all. And my journey has been a very pleasant one, I should say. When one hears the word cancer, one gets very scared. It actually all depends on when you are diagnosed with the cancer. If it's early, it's 100% curable. If it's delayed this thing, then it can be a bit tough. And sometimes if you are in good hands and good care, you can recover from any stage, I would say. In my case, when I was diagnosed, I am a person who will see a symptom and at once go and take a medical advice. Any sign which is not there, the body speaks itself, the people should go take the signal of the body and get themselves examined.
So true, Sangeeta madam. Thank you so much. The podcast, the way we will be doing is Sarita will be taking the questions, and I will be just listening to both of you from the viewers link. But before I leave, I came and I joined to show my respect to you, ma'am, as a president of such a fantastic organization, 46,000 gynecologists. And prevention of a cancer is actually our major aim, because at least cervical cancer, the only cancer against which HPV vaccine is available, and we can just bring the awareness and help them. But Sarita is the chairperson of an oncology committee, gynae oncology, and I must say she always comes out with the fantastic faculty. Madam, we have 30 chairpersons, so 29 more like Sangeeta. And every night at 8 p.m., one chairperson has been given an opportunity to come out with the brilliant faculty with whom they can have their podcast, which will educate not only the gynecologist, but the common public, because it goes on our social media, YouTube channel, and everyone. So today, having you is an honor of a Foxy. Listening about you, madam, is like I bow in front of you.
Oh my God, nothing at all.
Absolutely, madam. Taking two organization, the social work ahead. Secondly is giving your funds, whatever you were supposed to get from the government because of your position, because of Sri Arun Jaitley ji, to whom the country, every person respects, and that you are giving for the education of the children. Oh my God, how much karma and how much blessings you are collecting every day. And thank you, Sarita. Thank you for having her, because it's not only knowing your journey, madam, but knowing the work what you are doing now is going to motivate more people. Even if we can motivate 1% of the viewers that giving is a living, and start doing for those who need it, and those who have it should always be in a giving position. Even if this much message of your life goes, I do understand cancer, you need a strength. The first step when you get detected is the rejection. Then comes the acceptance. And probably Sarita may be interested in taking this aspect of your life to the public, but I'm more touched by listening to your CV, your biodata, your work, what you do. And what is touching to me is a daughter taking the father's foundation ahead, working for that foundation, and then establishing in 2019 another foundation, doing the work, and thirdly is denying the parliament money by the government and directing it towards the better cause. Ma'am, your life itself is giving too much of a teaching post cancer, all that. Otherwise, why Sarita would have chosen you? So you are a live example to live the life. Thank you so much for coming on Foxy platform. Believe me, this podcast were mainly for my chairperson to give them a platform, to give them a respect for the work they do so that they can have 1 hour of their podcast. But I joined to show my respect as a president of the organization to the faculty who is taking out their valuable time. And believe me, meeting 192 faculty till now, it was a life learning experience. And Foxy, at the end of these 365 podcast series, I don't know what we can do. We will have a huge collection of podcast with us. And Sarita, your one sentence, every day one project, really it is happening. And I'm handing over one more project to you. That is a Tata Trust want to do the work with the collaboration of Foxy. I already had the meetings. I said them, we will do, we'll go ahead. And I told Dr. Ashwini Kale, Dr. Sarita will be taking this project.
Thank you. Thank you so much.
Thank you.
But
Thank you.
I must tell you, my daughter's 42. So when your cervical cancer injection started, she was in her teens. And my pediatrician called me one day and she said, get Sonali over. I said, what? Get no, this new injection has come. I have to give it to her.
So beautiful.
So
Yes.
I had so much faith, I said, doctor, if you're telling me, I will get her. She has been inoculated.
That is what
That's wonderful.
Sangeeta ji is.
Yes.
We want to tie up with the pediatricians, with the IMA doctors, because if we want to catch them young, between 9 to 14 age group, we want our pediatrician standing with us. So, Do TK Jindagi Ke is my project. And also Nirmal Banaras is for the HPV screening. Unfortunately, in India, women don't do their routine screening. We all know that if you can catch at HPV positive, your survival rate is fantastic. To get the disease, it takes 10 years. You have caught them very early, and we can give a beautiful life to you. But that is what this Nirmal Banaras, we started from Banaras because it is Modi ji's constituency. And I felt that the central government, once we go to Banaras, they will think that this is a need of every city of India, and probably will join the hand with Foxy to help us to reach out to each and every lady in this country.
But that is what made me thinking when Dr. C.K. Bhalashi was a pediatrician in Gangaram Hospital. So long time, I mean, she's 42.
20 years.
She is 42, so she must be around 14 or maybe less than that when she got her 2 injections. So, and I have been interested in it, and I've been telling people that young girls should take it.
It's
Yes,
wonderful, ma'am.
madam.
So absolutely the right
Let's do
message.
something together, madam. It will be such a your huge experience and Foxy, the most important the task force what we have with the 46,000 gynecologists. We are too good in implementation of the program because we directly come in touch with our patients. So let's see after this podcast we can join and work together
Yeah,
sometimes.
definitely, definitely. I would love to do that.
Sarita, let's keep this link together. And when
Sure,
I
ma'am.
come to Delhi, I would like to come and see you, ma'am.
Yeah, definitely. You're most welcome.
Thank you, ma'am.
Thank
Thank
you,
you.
ma'am. Thank you
Thank-
so much.
Enjoy the podcast and I will listen
Thank you.
from other thing. Bye.
Thank
Thank you, ma'am.
you.
Bye.
Okay,
Goodbye.
bye-bye. So, madam, let us go moving forward. Just maybe you were talking about the disease, and maybe you can tell us more about yourself and your life before the diagnosis. What kind of has your life changed? Has in fact your attitude changed, your passions, your routines, your mindset, has it changed after the
It depends
diagnosis?
from patient to patient.
Hmm.
Whereas I'm concerned, nothing has changed for me. It's
Okay.
the same which I used to have the mindset earlier. Even now,
Hmm.
it's the same. It actually, the will of the patient,
Hmm.
how you take the things when they come in your life, it's for a person to decide. Either you let the disease take you over or you take over the disease.
Hmm. Yes.
In this, maybe any disease, I feel one has to remain positive and
Absolutely.
it's easier to overcome. If you get into depression or you think negative, then it's
Hmm.
very difficult. So I'm a person who's positive by nature,
Right.
and I
It's very
took
good.
even this disease in my positive nature. That's
Right.
what I did.
That's very, very important. I think the positive attitude is very important.
Very important.
Yes.
And so much so when I was detected by the disease in 2015. I still remember it was February 2015, and I met Dr. Bhatla and I told her, I'm having extreme bleeding. He said, okay, then we'll get ultrasound done and that. And some another doctor friend was standing there. Kehte, why wait this thing? Get a CT done and we'll get to know. So I went to get my CT done, and the doctor over there, he came and told me, ki, we'll have to give you contrast. I said, but you said it's a normal one. Why contrast? Have you seen something? He said, yes, so we need to do the contrast. I said, okay, then you've seen something in the uterus. He said, yes. I said, is it within uterus or has it come out? He says, no, it's within uterus. I said, okay, no problem. Give the contrast, we'll do hysterectomy and we'll be over with it. So this is the positive attitude.
Mhm.
If at that moment I would have said, oh my God, what have I got? What have this? I was
Hmm.
detected somewhere in, I think, around 10th or 12th February.
Mhm.
Then immediately the question was, now we know it is, and we rather get over with the surgery and be over with it. And at that point of time, in India, there were very less robotic surgeons.
Right.
So we made inquiry over here. There were three or four robotic surgeons, and they had done 200, 300, some few cases. And my only worry was at that point of time, I didn't want a normal or uh, normal surgery or this thing, because I realized, I said, if I get robotic done, less stitches, recovery would be faster. So that was my this thing. So at that time, uh, Dr. Nija Batla got the tests done, did the biopsy, everything. And then it was decided, then we realized that Dr. Mario Litayo has done few thousand cases,
Right.
robotic surgery. So then I decided that I wanted to go there.
Mm.
So Dr. Butler knew him. We got the contact, everything, went there. And my surgery took place on 3rd March 2015.
Right.
So it's been 10 years now.
Hmm.
And touch wood, I have followed everything to the T, what the doctor said. And I'm fully recovered
That's excellent.
now.
Yeah. So,
And
were there any movements where you felt that you wanted to give up or change direction? How did you handle the
no,
physical?
uh, actually for me, going to New York was a total contrast from what we have in India.
Hmm.
So when I went, they said, okay, you come in the morning, we'll do the surgery and you go back home in
Hmm.
the evening. I looked at his face and I said, is that so? Said, yes,
Hmm.
it's a minor surgery for this thing. You can easily go home. He said, fine. But then, I reacted to the anesthesia, so I was there for a day. They kept me
Right.
overnight in the hospital.
Okay.
But I realized that country is so overconfident about this thing that there is no infection in our system.
Hmm.
Even outside, when you go out, there's no infection. But we
Yeah.
people over here are used to, I guess, the climate, could be the
Hmm.
heat which is there,
Yes.
and
Yes.
it's cold out there.
Hmm.
Every country has their own this thing. But our doctors over here are also very good. At that point of time, because the robotic surgery was not so popular, I
Hmm.
went there. Otherwise,
Yes.
if I had a choice, I would have got it done here also.
Yes. Absolutely. Yeah. We
Uh,
have everything available nowadays
we,
here.
we have everything
Yes.
over here now, and I really admire how science and how our people are doing. In fact, when you go to a hospital over there, you see so many Indians working over there. I think their
Hmm.
hospitals are also managed by our people over there.
Yes.
So, and I have been one of those lucky patients who got detected at grade 1, stage 1.
Right.
So it was just a hysterectomy, and then when I went for my follow-up, and then the decision had to be taken that chemo has to be taken or no.
Hmm.
So the doctor told me, "Ki maybe we give you one cycle."
Right.
So I said, fine, you are the best people to judge. Whatever is
Hmm.
required is required.
Hmm.
And he told me, get this here, just hold on. How old are you?
Hmm.
So at that time, I was not even 59. I was 58
Right.
plus.
Okay.
So I told him, I said, I'm going to be in May 59. So then he looked up his tablet which he was carrying. And he says, oh my God, you don't even need chemo.
Hmm.
Goes till 60.
Hmm.
Don't give
Yes.
chemo on if it is
Yes.
stage 1, grade 1. I said, thank you
Yes.
so much. And the kind of research they do. And they asked me when I
Hmm.
had gone for my checkup and this thing. So another research department people came to me. They said that, do you mind if we keep a sample of your tumor?
Right.
I said, what are you going to do with it? He says,
Hmm.
we're going to do research and see
Hmm.
why Asian women get this. I said, by
Right.
all means. I said, if the future ladies of the world can benefit from my tumor. Why not? I'm sure someone must be doing research on it right now.
Yes.
So for me, it has not been difficult.
Right.
I didn't become negative. And of course, my family supported me through and through. I still remember when the budget during those days was always on 28th February. And my
Yes.
surgery was slated for 3rd March. So my
Yes.
husband Arun, he presented the budget. And he took the night flight to New York, stayed with
Yes.
me, got my surgery done. When I came around, I looked up at him and I said, "You're still here?" I said, "You got a flight to catch, go." So he was back in Parliament defending the presentation and explaining the budget. My children throughout were by my side. My sister was there with me. So the family support to the patient is also very important.
Yes, absolutely. Luckily, we have that close knit families in India.
Yes,
And that is a huge support, actually. It's a
yes.
huge support. Unlike the West, where they don't get much of family
They don't
support.
get the family support.
Yes. Yes. True.
I'll tell you about the family thing, which I really tell you my experience in the hospital. When they said, "We are going to discharge you," I said, "Okay, fine." They said, "Now make sure that there is someone over here to take you home. And there is a vehicle waiting for you to take you home." So I said, "Yeah, yeah. My family is here and vehicle will be there to take me home." And I said, "Why?" My son came. I said, "Why are they asking me this question?" So he said, "Mom, over here, people come alone to the hospital, get their treatment done. And that's why they say, make sure that someone from the home is there to take you home so that there is some help for you over there."
Absolutely.
Yeah.
Very true.
I'm actually grateful that I'm born in India and the family system and the support system is so good over here that we tend to
Yes.
look after each other.
Yes.
Yeah.
Yes. It may be in family, and if not family, even close friends, they also pitch in so many
Yes,
times.
everyone pitches it.
Yes.
That's
Yes.
all this thing.
Yes. So did they were and did your relationships change either positively or negatively during this time of treatment?
No,
You
for
think?
me, it was actually a kind of a normal hysterectomy. So the pain and the thing was there, but I'm basically a person, you can't have negative thoughts in you when you are undergoing even a normal surgery. You have to keep yourself positive. And if you are positive, you tend to heal faster.
Yes.
That is a very important thing too, which I experienced, that you must have in you. If you're
Yes.
negative, then your healing process is less, your healing is slow, and some kind of complication or something tends to come up.
Yeah, what happens is once they hear the diagnosis of cancer, they think that that's the end of life, that
Yes,
nothing is going to.
yes, that is what is I've been trying to tell you. You should not get scared.
Yes.
Focus on getting oneself treated.
Yes.
The family has to rally around the patient so the patient doesn't go in depression. Lots of the attitude of patient depends even on how the family behaves.
Yes.
If the people around the patient are positive, ki, yeah, you'll get out of it, the
Mm.
patient also starts thinking on those levels.
Mm.
But if there's negativity at home, the patient also gets negative.
Mm.
That's very important,
Yes.
I feel.
Yes, ma'am.
And another thing which I feel which has helped me, I meditate quite a bit.
Mm.
So when you meditate and you
Mm.
go inside you, I think the healing process, some natural healing process is also there. So the regeneration of your cells take place. I don't know
Mm.
medically how correct it is, but I feel lots of comfort that way.
No, it's actually very, very important, meditation, and this actually helps in giving a balance, a mental balance
Yeah.
to the person.
Yes, when
So,
the balance is there, your
mm.
regeneration of cells is faster.
Mm.
That's what I.
Yes, yes, absolutely. So they were, yes, I think this about spirituality and anything else you feel helped in your recovery.
You have to eat the right kind of food.
Mm.
That is very important. I mean, for a person who has gone through this, has got malignancy or recovered from it, like processed foods are completely out.
Mm. Yes.
People eat sausages, ham, this thing, these are
Mm.
completely out. This is
Mm.
what my doctor in Sloan Catering told me, Dr. Mario.
Right.
And he says, you don't eat this processed food. Otherwise, you can eat
Right.
anything. In processed food, I don't even eat soya.
Right. Okay.
You have soya nuggets, you have this thing. So I don't know. I'm completely off those things.
Mm.
And usually I stick to the normal fruit, vegetables, these kind of things, which, I mean, our elders must be eating during their lifespan.
Mm.
So I don't eat processed food at all.
Right. So after do you feel that anything were you surprised about yourself during this time, how you actually went through, where was there anything you felt that you may not have been able to do it, but you actually could do it?
No, but I think generally I've been very happy with my life. My life has been ideal, this thing, even in school, college.
Mm.
The life was of a school girl, a college girl, always into studying and pursuing the games which I liked. So after my post-graduation, helping out my father with his various things during my college days also. And then after my marriage, it was just helping out because my husband being very busy. So I
Mm.
just knew how to manage the house, manage this thing. In fact, I didn't uh, take up any profession because of this very reason that
Yes,
the children need at least one parent around.
absolutely, ma'am.
Ha. And
Yes,
since I realized after my marriage that he kept very long hours, being a lawyer,
yes.
it meant early in the morning, coming back late at night. So that was a
Mm.
conscious decision which I took, and I think I've been happy with my this thing. Uh, Nothing which I can regret happened in my life, except, of course, losing my husband. But
Mm.
everything else has been good for me, and I would not like to replace anything with anything else.
Right. That's very That's very lucky, I know that you feel like that.
Hmm.
Yeah.
So any person who needs any help or something, I'm always there for them.
Right.
If
Yes.
someone approaches me, whatever little I can do, I try to do. But
Yes.
the
Yes, I
journey
think
is
you're
back.
doing a lot. I think you're doing a lot, actually.
Thank you so much.
Yes, yes.
Thank you. Actually, I said, I don't need the pension. And at that moment, then I realized, I said, uh, Arun had been a member of Rajya Sabha for almost from 2000 till 19. So for 19 years, almost 20 years, because he started going to Rajya Sabha in 99
Right.
when he became a minister in uh, Honorable Atalji's government, Vajpayee's government. So I realized no other better tribute to pay to these Class C people who work over there, as contribute to them some scholarship or medical help or anything. Because anything can happen anytime in any month's time.
Yes. Yes.
So my instruction to them, I transfer the money to Rajya Sabha Secretariat, and then they
Right.
decide what to do and whom to give.
Right.
They
That's
told
a
me,
very,
would you like to come and see whom? I said, no, I go by your this thing. You please take the thing. I don't want to be involved in distribution or anything. I'm sending the money. You all decide whom to give, whoever the needy person is, please help them out.
yeah, I think that's a very generous, very benevolent gesture from your side. I'm sure many families would be benefiting from it.
I'm sure there must be, and because I do
Yes.
get a list that this much was given to this one and this.
Right.
But it's
Okay.
okay, let them decide. And my only this thing was that these people, when my husband was there as a member, he used to look after him, you know. So this is
Yes.
small bit thing which I can say as a thank you to them for what
Yes.
they have been doing for so long.
Yes. So, madam, do you actually are you in a support group, or people who are affected with cancer? Do you counsel them, and or you would like to start something like that?
I do help those people who come to me or need my help. If anyone needs advice, I'm always available.
Right.
So that is no problem. As officially, if I have joined someone or the other, I haven't.
Okay.
Yeah, if someone needs my help, initially I told few people, I said, if you need me to come to the hospital, speak to someone who's down and out and thinking, it's the end all, end of everything. So I have told few people, I said, if you need, and I'm telling you also, if you feel I can be help in counseling someone, I said, when they see me standing in front of them who has survived cancer, I can easily come to the hospital. You give me a call, I'll come, I'll speak to them, help them out. There's no problem.
Thank you. That would be very nice. Yes.
Yeah, I know the system in our society is such. You hear the name cancer, it's more than the patient. I think it's the family who gets into depression.
Yes.
And the family, I think patient, while seeing the family depressed, gets depressed herself. So it's what I said, to have positive people around you makes the environment much more better. And if someone is down and out, and I can go and tell them, look, I have had the surgery and I have gone through, and I'm a survivor. If that helps, I'm willing to come to the hospital and speak to the patient. That's no problem at all.
Also, the other thing that people think, once the surgery and the treatment is done, they think everything is over. They don't come for follow-up. So what is the
Follow-up.
message?
Follow-up is a must. Even now 10 years are complete, but even now regularly I am going and getting my checkup done every year. Maybe if it is not after 12 months, maybe after 13 months, but my checkup is there.
Yes.
Even if I'm caught up with some work, or my GANAC is not available for, say, let's say for 10 days or something. But then we make sure that the checkup is done. You can't ignore that.
That's the only way that they can pick up if it's coming back. But what they feel is, if they have no symptoms and they feel they don't need to come. It's very commonly we see, especially in India, in our women. They get busy with their own work and with their own families, and then they don't come.
No, the checkup is very, very important. And I'm amazed it's not only the uneducated ladies who ignore themselves, even the educated ladies.
Educated, yes, I know.
Educated ones ignore themselves. My advice to everyone would be, please don't ever miss your checkup. Because I remember earlier it used to be in the first 2 or 3 years, it used to be every quarter. Then it became half yearly. Then it became yearly. But I have been religiously following my follow-ups. Checkups are a must.
Yes. So what message would you give the listeners to take away, ma'am, from your story?
The message I would like to give is to the listeners, and I'm sure most of them are doctors, gynecologists, is please make sure that your patient is in a positive frame of mind. Half your problem, the doctor's problem, will come down by 50% if the patient is positive. Things happen in a positive nature. The healing is faster. And you should actually tell the patient, I'm sure you doctors don't have so much time since we have so many patients lined up. But especially if you're nurse or someone who's there, should advise them to eat the right kind of food. No processed food. That was one thing which he told me. No sausages, no ham, no this thing. So I've not touched any of this thing in last 10 years.
And what would you advise them about their relationships? I mean, because quite often they're worried, that their family will not accept, or their family will be. They're quite there.
No, the family has to accept. There is no change in the body. There is nothing which affects you. You can lead a normal life. That is very important. Yes. The patient can lead a normal life after recovery. And this, I think, has to be put in the patient's relatives, the family, especially the first family, that there is nothing wrong with the patient. She is absolutely normal. Everything can be done in the normal way. And she's there for you. She will look after the family. She will do her job. She will do everything the way it was earlier. Only time has to be given is for her to recover fully.
Yes.
That's very important.
Yes.
Once her strength is back,
Mm.
she can move out, she can do anything.
Mm.
If the patient does her, she can dance all what she wants. That's no problem at all.
Mm. True.
The
Absolutely.
patient's relatives have to realize that she is normal and
Mm.
the life can go on as if nothing had happened. But to make sure that the patient goes, it is responsibility of the family also to make sure that the patient goes back for the checkup on time.
Mm.
My family, my children, Arun, my husband,
Mm. Mm.
they were very, very clear that
Mm.
I went for my checkups and follow-ups regularly.
Yes.
And this checkup is nothing. It is like when you go to a ophthalmologist for your eye checkup.
Mm.
You go every 6 months or you go every year to get your eye checkup done.
Mm.
Similarly, there is no uh, taboo in going back to the doctor, to the gynecologist and saying, please do my checkup, and that's it.
Mm. Absolutely. That's a very important message. It's so important to, at least that is the way, then and this checkup has to be for life, every
It has
year,
to be for life.
every year for life, the whole
You
life.
can't say now
Yes.
I'm not going to say, oh, I've had
Mm.
10 years, nothing has happened, now I'll take it easy. No, it
Mm.
has to be every year.
Yes.
You just can't. I regularly look up my file, the date of my last checkup, and I try to do it around that date the next year. So yearly
Yeah.
checkup or the follow-up, as the doctor says, is very important. This is one thing I have taken out of my life, that
Mm.
checkups are the main important thing in life now.
Yes. So, ma'am, is there a cause, an organization, or a project that you're involved with that you'd like to share?
Now, I'm running this Arun Jaitley Foundation,
Yes.
and we try to help out people in
Hmm.
whatever way we can and how we organize things. It's some needy people, if they come for scholarship or something to help them out
Hmm.
in education, we do that. Even there's Gidharilal Dogra Trust. Even in
Right.
that, we are doing the same thing. Some medical help or something. We try to help in whatever way we can. And let's see. Now, since we
Yes.
said we look forward, I like to meet Doctor when next time she's in Delhi, we can fix up something, meet, and then see how we can tie up and get the things done.
Yes.
How far we can go in that.
Yes. I think you as a speaker would be very useful for, to motivate the people, the public, for health awareness, for getting themselves,
Check them. That is
aware
very
about
important.
themselves.
Very important.
Yes.
The girls, I
Yes.
firmly believe that for cervical cancer, wherever we can help to get the
Hmm.
injections and all, it's very important that we get it done. Especially
Yes.
uh, to young girls, to the daughters of the uneducated mothers who know nothing.
Hmm.
They should be motivated to get their daughters injected.
Yes.
That is very important.
Yes. Yes, ma'am. So this the recording would be on YouTube, but is there anything anywhere, any other place where people can find you or follow your story?
I think they can all follow on the YouTube on this thing. And
Yes.
I will tell Padam to be in touch with you so that
Okay.
if the link has to be given somewhere else, we can do that also. That's no problem.
Okay.
But you feel free to put the podcast wherever you want. And if ever you need my help for anything, please let me know.
Thank you so much, ma'am.
Mm.
Thank you so much for joining in, and thank you so
You
much
want me
for
to come and speak to a patient, you want me to come and motivate someone, I'm willing to do that also.
that's very kind of you. Thank you. Thank you so much.
Thank you for calling me. Thank you so
Thank you,
much.
ma'am. Thank you so much. Good night.
Good night.
Good night.